Hi everyone, welcome to this lecture. Most people tend to think of parenting and parent-child relationships as a very personal thing, something within the private domain. And what caregivers might do to their children, how they are brought up, is also considered personal and within parents' rights. Rarely do we think of parenting in the context of public health. This is why national policies that have implications for families and parenting can be very controversial. But what happens in the home does have consequences for children's welfare. And to the extent that we believe that children are our future, then what happens in the home is meaningful to wider social development. In my presentation, I aim to make 3 points. First, that child maltreatment and by implication, parenting are global public health issues. Second, that parenting is a key strategy to prevent violence against children. And third, I wanted to give the example of our program, Parenting for Lifelong Health, Masaya Familia, as an example of a program that is culturally relevant, rigorously tested, and has the potential to be scaled. So first, a definition. What is violence against children? The World Health Organization has defined violence against children as all forms of physical and emotional harm, maltreatment, abuse, neglect, and exploitation that are detrimental to a child's health, development, well-being, and dignity. Does this include verbal forms of punishment? Shouting, screaming at your child, insulting? Yes. Does this include spanking, slapping, hitting a child with a belt or a hanger or a slipper? Yes. These are all forms of violence. Yesterday, I was at a webinar with 1,000 participants. And one of the questions that were asked of the participants in the poll was whether they had ever experienced being spanked as a child. And a full 75% of those 1,000 participants said yes, and only 25% said no, they were never spanked. So that's the lucky minority. So unfortunately, spanking is very normative in our cultural context. That experience in that webinar is borne out in national data. So you see here in this slide are numbers from the 2016 National Violence Against Children Study with a representative sample of nearly 4,000 young people. More than half reported experiencing physical and psychological forms of violence before the age of 18. Worldwide, approximately 1 billion children, or more than half the world's children, experience violence. Moreover, majority of the violence experienced is at the hands of family members. The experience of violence or maltreatment has insidious, far-reaching, and lifelong implications. Apart from the immediate risk of injuries, the experience of violence can really get into a person's system, affecting them physiologically and psychologically. A wealth of research has reported that persons with experience of violence are at greater risk for chronic diseases, such as heart disease, diabetes, and cancer. Violence against children is also associated with conduct and antisocial behaviors, aggressive behaviors, and delinquency. If you look at the profile of children in conflict with the law here in the Philippines, the great majority of these young people have experienced dysfunctional parenting and maltreatment at the hands of family members. Mental health problems are also associated with violence against children, depression, anxiety, suicide ideation. And it is also implicated in substance use and sexual risk-taking. And I'd like to add, there is a strong tendency towards intergenerational continuity. For these reasons, violence prevention has been explicitly included as a crucial component of sustainable development because child maltreatment has such far-reaching consequences. So member states of the United Nations had pledged to support and meet the Sustainable Development Goals by the year 2030, and these goals include the ending of all forms of violence against children. Parent and caregiver support is among the 7 evidence-based strategies to end violence against children recommended by international development agencies. So INSPIRE is an acronym. It stands for the initials of these 7 strategies. And it's important to note that parent and caregiver support should be integrated with all these strategies, because violence against children is a systemic problem that requires systemic solutions. So these strategies include, for example, implementation and enforcement of laws. It includes efforts to change cultural norms and values, income and economic strengthening, and education and life skills. We know that among the risk factors for violence against children is extreme poverty and lack of education. This is why these other strategies are necessarily integrated with parent and support interventions. So how do effective parenting programs work? What are the components to be considered based on the research evidence? So in this slide, you will see a framework or a theory of change that has been tested in several studies. The first column is about the effective components of how these parenting programs should be delivered. So programs should emphasize the learning and practicing of actual skills in ways that are participatory and non-didactic. Facilitators should be able to model these skills and practice empathy. Parents need to feel that they are not being judged or criticized. Rather, they are being helped and supported and understood in the hard work of parenting. I really want to reiterate that teaching parents skills is important. It's not enough to do lectures or to educate them about how to parent. When we ask parents whether they think it's necessary to use corporal punishment to raise their children, majority of them would actually say that they don't think it's necessary to use corporal punishment. So this belief seems to be disconnected from the actual practice of majority using corporal punishment. So we think that this disconnect between the belief and the practice is based on the fact that parents don't have other skills that they could draw from. Perhaps they don't have enough strategies in their toolbox for how to bring up their children. And so they end up falling back on strategies that they already know or strategies that were used on them. So we need to teach parents really practical skills. So these skills might include how to spend quality or one-on-one time together, where the child has the opportunity to lead the interaction or play, and the parent giving full attention to what the child is doing. How to give effective instructions, how to set limits and rules, giving specific praise, how to follow through with effective consequences when children don't follow the rules. And importantly, how to help parents reduce stress and manage their anger and negative emotions so that they could address children's challenging behavior with calm. So clinical trials have then shown that teaching these skills in these ways reduces harsh parenting, strengthens positive parent-child relationships, increases parent confidence and sense of efficacy. For both children and adults, this means reduced behavior and mental health problems and reduced violence against children. So parenting programs benefit both the child and the parents. So going beyond the program itself, there are other factors to consider when developing and implementing and scaling parenting interventions. First, are these culturally relevant programs? Are they feasible to implement in community settings? And are they economical? Governments will not invest in programs that cost too much. Second, in terms of implementation, can we enhance family and community engagement and reduce barriers to their participation? And while doing so, can we ensure fidelity to the core components of programs that make them effective? Can we use scientific and evidence-based methods to evaluate these programs, the delivery systems, and service providers? This is a real challenge because in service provision in our country, evaluation, using scientific methods is not often done. So even that language of scientific and rigorous evaluation is something that we need collaboration with. We need to collaborate with academic institutions, government agencies, and service providers. And last but not the least, can the program be scaled? Can we integrate these programs in existing service delivery systems? Can we foster national and local support and ownership for these programs? Scaling programs is really important because we want them to benefit as many families as possible. So at this point, I want to give the example of our own work, Parenting for Lifelong Health Philippines, and our own program, Masayang Familia para sa Batang Pilipino. This is a multi-sectoral collaboration among academic institutions and scientists, child protection advocates and service providers, the Department of Social Welfare and Development, and UNICEF. So we culturally adapted Masayang Familia from a South African evidence-based parenting program called PLH for young children. And in our program, which we also call MAPA, Masayang Familia, MAPA for short, we use the framework of a masayang tahanan. As we all know, a house has two major components, the foundation of the walls and the roof. Okay? The walls of the house are comprised of the core skills that aim to strengthen the positive parent-child relationship. So these include one-on-one time, how to use specific praise for positive behaviors, how to give directions, how to maintain household rules and routines, and how to address emotions in the self and in the child. On the other hand, the roof has to do with effective and non-violent discipline strategies. So for example, redirecting a young child's attention from a negative behavior to a positive behavior, or how to use consequences effectively when children go against our household rules, and how to solve problems in the family involving children. So our psychological framework rests on this fairly simple dictum. When the walls of a house are strong, the roof will stand. Or, kapag matatag ang dingding, madaling pagtibayin ang bubong. In other words, as we strengthen the relationship between parent and child, the need for discipline actually decreases because good behavior is easier to maintain. In this program, we used a lot of participatory methods. I have pictures on the slide for you to look at. We also use comics, which is a very culturally appealing way to reach parents. And we use a lot of practice of these skills and a lot of coaching by the facilitators. So we've implemented and tested the MAPA program in 4 trials in different communities in Taguig and Quezon City in the last couple of years. And we found evidence of efficacy in our randomized controlled trial involving family beneficiaries of the Pantawid Pamilyang Pilipino program. In comparison to control families, we found a 39% reduction in overall child maltreatment 1 month after the MAPA program, compared to families who did not undergo the MAPA program. This reduction in child maltreatment was sustained even 1 year after the program. It's important to note that we tested this program within the 4-piece conditional cash transfer system because we wanted to test whether it was feasible to implement this program within an existing national service delivery system. So in the 4-piece program, beneficiaries receive cash benefits. In exchange, they have to meet certain health, education, and parenting goals. So for example, they have to make sure that children are vaccinated, that their kids are enrolled in school, and that they attend parenting programs. So we integrated MAPA as one of the conditions for receiving cash benefits. And in our trials, we found that that was feasible and that it's a possible way of scaling up this program. The COVID pandemic presents us with a new and unprecedented challenge. More than ever, families need support. Families face increased challenges from unemployment and financial instability, increased stress, reduction in support, and school closures. Studies have shown that violence against women and children tend to increase during emergency situations. But what to do now that we cannot implement face-to-face programs in the community? So together with our global PLH partners, we have developed other means to disseminate the MAPA parenting messages and skills. Shown in this slide are MAPA tip sheets. We have developed 15 in all that encapsulate the core MAPA skills, and they are translated into 12 major Philippine languages and can be freely downloaded and disseminated and used by different service providers. For the past several months, we have also been running several webinars for social workers, teachers, doctors, child protection advocates, who are parents themselves, so that they can be oriented and supported in how to use the online resources that we are developing. We've appeared in radio, in Facebook. We are developing a parent support app that would provide text messages for free in partnership with UNICEF and DSWD. We have a Facebook page where you could find our resources. And of course, in all these initiatives, we are constantly testing the accessibility, the relevance, the usefulness, the effectiveness of these messages. And in fact, it's an exciting time for us. Could this, in fact, be a means to scale our parenting programs? If we find that they can promote behavior change in caregivers, then what a fantastic opportunity this is to harness and convert this challenge of COVID into an opportunity to broaden our reach and influence more families to care effectively for their children. I started this work as a child advocate, and today I am firmly a child and parent advocate. Parenting is hard. Caring for children and feeling responsible for their future. Such a responsibility. I am a parent myself, and I have made many missteps towards my own 4 children. And so we owe it to our fellow caregivers, our fellow parents, and our children most of all, to support and teach each other. To me, this is what being a developmental scientist is about. Supporting parents and caregivers in ways informed by science, public health, and child protection perspectives can bring our children closer to a future that is free from violence and that nurtures families and therefore society's health, development, and well-being. Everything I've learned and contributed and have shared today, I owe to all the people and organizations who have collaborated with Parenting for Lifelong Health Philippines. Maraming salamat po.